Welcome to lecture number 2 in nu210, Nursing Concepts. This week's lecture is on the historical perspectives in nursing. This lecture was put together by Dr. David Sharp. Reflecting back to what we looked at last week, remember we asked, is nursing a profession? We know that it tries to be. We do everything we can to be professional, to act professional, and be responsible as professionals. But how do we recognize a profession? There are different approaches that look at this process. The power and the traits thereof also. How do we recognize a professional? How about a doctor? How do we recognize a doctor, which is a profession? Or a religious leader, is that a profession? How about a lawyer or a judge? Is it by what they wear? Is it by their title, their education, the way they act, the job that they do? How about a nurse? Is it because they wear scrubs, a certain color scrubs, certain level of education, or what they accomplish and where they work? So how do we recognize a nurse? How about behavior? How does a nurse behave? What is it that they do? Certainly it must be a professional behavior and a therapeutic behavior also, because we are encouraging folks to enter into a high optimal level of wellness. How about the dress of a nurse? Are there certain required uniforms? It's mostly dependent upon the institution that they work in. Are there symbols? The Red Cross, the nursing pin, the nursing hat. What is the difference between a physician and a nurse? Take a few minutes to pause the audio. Take a sheet of paper out, pencil and pen, and jot down a few ideas. And when you're finished, go ahead and replay the audio. The word nurse comes from the Latin word nutrire. This means to nourish, nurture, or suckle a child. We do this in our families. During the early Christian period, roadside houses for the sick, poor, or destitute were cared for by male and female attendants, and we learned by trial and error from observing others. This was the earliest beginnings of the nursing profession. To nurse meant caring for not only those who were sick, but making access to care easily available, so helping them in whatever way we needed to get them to care, recognizing that men and women could provide this care. So it's not necessarily a woman, it's not necessarily a man alone. We participate in these together. Nursing was an apprenticeship learned through observing others and working with patients. So when one wanted to become a nurse, they just went to work with other nurses, and the other nurses taught them how to be a nurse. You look at your PowerPoint slide, you'll see there's an image from World War I. But you see the knight in the background, probably a Knights Templar or hospital nurse. Why would that knight be featured in this Punch magazine from 1914? Well, it has to do with the history of nursing. When we look at hospitals, they were developed out of a military need. They were based on the practices of the enemy, the Saracens. Now, in Greek medicine, there was a hidden form from the Europeans during the Dark Ages. This was the knight hospitaller, formed to care for the sick after battle. That's where the idea of hospitals came from, and it was taken home to Europe. Now, looking at the post-Reformation period, the role of women reduced under Protestant leadership. That sounds a little sexist and not right, but that's exactly how it happened. And then male nurses disappeared. That was the Knights Hospitallers. Secular nursing orders were established, so the church was not necessarily preparing nurses. The nursing hierarchy was established. Primary nurses were sisters and were assisted by helpers. Now, looking at World War I, there was a great increased need for many nurses. And I can imagine that had to do with the increase in the wounded and the numbers of the mortality rate. Because when we went from the Civil War period to World War I, deaths and woundings increased exponentially. It went from the thousands to the millions. And untrained women were recruited as nurses. Now, there was some debate on the level of training that was needed. And of course, there's the idea and the view that nursing is, quote, women's work, unquote, and that it requires little training. Then there's the nurses' aides that were cheaper and began to replace the trained nurses. These issues and debates are still major issues in today's nursing. We still are ironing out and hashing out what exactly an unlicensed assisted person can do, a practical nurse, registered nurse. Now we have the individual states' boards of nursing that determine these, and it can vary from state to state. Some states allow unlicensed assisted personnel to discontinue Foley catheters. Some don't. Some allow practical nurses to start IVs and hang IV bags. Some don't. You have to look at each state's scope of practice. But the general scope of practice does separate out what we can delegate to unlicensed assistant personnel, etc. Now, there are some symbols that came forth in nursing. One of them was the lamp, which was associated with Florence Nightingale. There's a lot of personal feeling about the lamp. One might tend to be religious and think of the light of the world as delineated in the Bible. One might just think of being a light to help in times of darkness. Think about it for yourself. Read the text and decide for yourself, what does the lamp mean to you? And then there's the nursing pin. This is a symbol of values, goals, and expertise. It was also a badge of excellence that was awarded by Florence Nightingale to graduate nurses. The pinning ceremony marks nurses as a unique group of health professionals, and it recognized the legal authority as licensed professionals. The pinning ceremony is a very, very climactic event when graduating from nursing school. We make a big deal out of it here at Louisiana College. We make it a celebration. We sing and we pray. We present awards. We recognize the biblical character qualities that our nurses graduate with. We get to know folks, and therefore we kind of know their makeup, and we see which character quality really suits them. And then we have our dean say a little bit at the ceremony to just congratulate you and lift you up and encourage you as you go on into your career. This is a very enjoyable time. This is a time of celebration, as I said before. We are very, very, very spiritual in this program, and we believe in experiencing emotions that circle around this pinning ceremony. Now, looking again at the lamp that Florence Nightingale started, there are several images in your PowerPoint slides, 3 different lamps. Does that look like the classic image of a nurse? When I see that, it presents to me the classic image of Florence Nightingale and the nurses of her caliber and that came from her school in her time. Then there's the nursing cap. Personally, I really am not attracted to the nursing cap. Some of you may think it's a great thing, especially those two. And then, of course, the third's a little more generic. Might even be non-gender based. As you look on your PowerPoint slides, you'll see the first classic, the Florence Nightingale's cap, and the ones that look like surgical caps. Most of the times we don't even wear caps today, but when you go to surgery, we do wear those caps. It's an early religious meaning, but Nightingale recognized the use to protect nurses from patients, and it was eventually viewed as something that didn't really need to be worn. We didn't have to have that, and it was kind of sexist and gender biased. Professional deportment, standards of dress and behavior expected of nurses. These are college-based standards and those of the hospitals. Now, looking at the popular images of nurses, there are really 2 extremes. This first, if you look on your PowerPoint slides, shows an angel of mercy. Really beautiful woman with wings, white wings, the Florence Nightingale cape, the typical nursing cap, And the other spectrum of the scale would be a very, very sexist image of a nurse. You can also come to Cavanaugh Hall and see our display where we have some popular images of nursing. And it's easy to identify by the children's toys that are present there. Now let's look at nursing licensure. Why do we need licensure? Well, we have standards that are regulated by state laws. These state boards use the NCLEX licensure. Pretty much all 50 states use this to determine that you can practice nursing at a safe level. They're not really looking at the level of education or judging you in that way or assessing you that way. They just want to make sure that you are safe to go out into the public and to enter into this career field of nursing. They understand that you have some serious things that you deal with. The medications that you'll be administering can harm or even kill life and destroy life. That's why we have to be very careful. We have to be very skillful. We have to know the background behind the drug. We have to know the background behind the tools we use. We have to have the tactile skills to be able to handle needles and other instruments. We need to know and to determine that you not necessarily will be a good nurse or a great nurse, but you will be a safe nurse. And so that's why the licensure system has been put in place. Also, there are legalities. If they run a background check, take your fingerprints, and find that you were convicted of a felony in the past, it will pop up, and it may hinder you from receiving your licensure in that state. How about nursing education? What do you think we need to know? What level of education? Do we need a bachelor's, an associate, a master's, a doctorate, a terminal degree, several masters? Well, it really depends on where you're wanting to go in your career. If all you want to do is practice nursing on an institutional floor, such as a med-surg floor, or an ICU floor, or say even in a nursing home, you may not want to advance past an associate degree program. But if you want to get into leadership, middle management, or advanced practice, you will need to get a baccalaureate and or a master's degree. Some places may even require a terminal degree, a DNS, DNP, or a PhD. But nursing is becoming more technical in some places. Nurses are expected to be critical thinkers and assume responsibility for their practice. So advanced education is one way that we learn how to use these critical thinking skills. We also learn to assume responsibility for what we do. If we bring harm to a patient, we are responsible. And vice versa, if we really assist a patient in achieving optimal wellness, we share in the rewards of that. Outcomes. That means where are we looking to get you to? We need to be able to pass that NCLEX licensure to obtain an RN license and demonstrate that we can safely practice. Now this indicates a basic entry level. This is not advanced practice. There are many programs that are ADN programs, associate degree, that also take the same NCLEX and they receive an RN license. Many institutions pay a little bit extra per hour for the BSN over the ADN. Some institutions have decided that they will only hire BSNs. Not all institutions have done this because they recognize that coming to that point, the outcome was just to get you to that place that you can be safe when you go to work. It's a basic requirement. Now this is a BSN program, Baccalaureate of Science in Nursing. Therefore, our students need to be educated as well as trained. Now sometimes this can cause tension. There's decisions to be made. There's a lot of critical thinking. There's a lot of constructive criticism. A lot of assessment testing, practicum checkoffs in tactile skills. This causes a lot of stress. Remember, the BSN degree is an entry-level qualification into the nursing profession. You are the ones who graduate from the BSN program. You'll become tomorrow's nurse leaders. You'll be in the clinical areas, you'll be in middle management, maybe even upper management, and you'll be doing the teaching and the research in our institutions. That may require that you need to go from a BSN to a master's level. The master's level is usually 30 to 35 more semester hours. You have more practicum hours. It can be in a nurse practitioner field. It could be in any other advanced practice. But if you want to progress, you will need to consider becoming proficient at the master's level. Of course, if that's not your plan, then you're on the wrong track here. You're going the wrong way. You could have gone to an ADN program with a 2-year plan. That's the end of today's lecture.